Hi guys, this is Alicia with Good Morning Sunshine. So I'm going to go over with you today 2 lectures. We actually brought in toxicology now into this course. It was actually really interesting actually. And then one of our professors decided not to show up to his lecture, so don't have that for you. Even though he has a lab, he's still doing the lab. So I don't know what happened there. But we had bacteriology this morning, which I don't do a Word document on, so I never discuss bacteriology. But I will discuss toxicology with you. So we went over the intro today with toxicology and toxicokinetics. So toxicology basically is the study of the adverse effects of xenobiotic compounds, so toxins or toxicants, including their chemical properties, their biological effects, and their treatments. So poison is any substance capable of causing a deleterious response in a biological system, whereas a toxin is basically produced by living organisms, and that's how she talks about toxins, which is a poisonous substance that is a specific product of the metabolic activities of a living organism. They could be antigenic poison or venom of a plant or of animal origin, or a subset of toxicants. But a toxicant is talking about man-made products, so it's a synonym for poison toxic agent. So factors determining toxicity are dose, duration, frequency of exposure, route of exposure, ADME, and physiological factors. So starting with dose, this is the amount of drug, toxin, or toxicant that reaches the site or sites of action in an animal. So dose increases, then we get into overdose territory, which means our toxic territory. Which then, therefore, there's toxic doses of a drug, and there's also lethal doses if we're getting above the effective dose level, as we can see in these diagrams here. So factors determining toxicity for dose. So we have, again, our ED50, which is our effective dose. So this is the dose producing a therapeutic response in 50% of the population. We have our LD50, which is the dose causing death in 50% of the population. And then we have our LC50, which is the concentration of a toxin or toxint that will cause death in 50% of the population. So basically, the lower the LD50, the more toxic the drug is. The higher, they're not as toxic here. So here's a few on this chart. I'm not going to go over with you, but botulinum toxin is at the way bottom. So this would be the more toxic drug. And then we have ethanol here at the top, which is not as toxic. It's still toxic, but not as much as botulinum toxin. So then we're going to talk about bromethylin. LD50 is a variation in species. It's a rodent pesticide. It's sold as bait blocks, pellets, bars, and worms. We also have single feeding rodent pesticide. So it's a mole killer. That's just, it takes one bite of this and your animal's toxic. So this leads to sudden death, vengeance, trounce, and assault. So some of these are what they look like. And then we got into the toxicokinetics of bromethylin. It's not toxic actually by itself. It's once it gets demethylated by the liver, which creates desmethylin bromethylin. So it disrupts the sodium-potassium pump and causing cells to swell and basically become dead. So then in a dog, LD50 is commonly around 2.5 mg per kg. For a guinea pig, the LD50 is greater than 1,000 mg per kg. And then for a cat, the LD50 is around 0.54 mg per kg. And then a mouse, their LD50 is around 2.0 mg per kg for this drug. So cats are the most sensitive to bromethylin when it becomes demethylated. So factors determining toxicity continued. Too little, too much. Toxicology itself is the study of the adverse effects of exotic compounds, so toxins or toxicants, including their chemical properties, their biological effects, and their treatments, like I said earlier. So then we get into selenium, which is a trace mineral animals need. It prevents free radical damage in tissues. It maintains proper immune, muscle, and heart function. Selenoproteins in the skeletal muscle help cells sequester calcium. So if we have selenium deficient soils or if we have feed mixing errors, the skeletal muscle cannot sequester calcium, which then yields calcification of tissues. So this is also known as white muscle disease, which leads to cardiomyopathy and then lastly death. So here's just a chart showing you guys. Selenium intercalates into enzymes, replacing sulfur, causing depletion of glutathione, which yields oxidative tissue damage, like I said. If you ingest selenium accumulating plants or you overdose, so an injection or for feed mixing errors. But yeah. So then we got into zinc, which are trace mineral animals also need. It's a cofactor for enzymes, proteins involved in cell division and growth. It maintains proper immune system and it's a skin protectant. So if we have zinc deficient diets or genetic predisposition causing malabsorption of zinc from the GI tract, so huskies are predisposed to this. The zinc inhibition of red blood cell enzymes leads to oxidative damage. So if we ingest high zinc containing substances, also leads to this as well. So now getting into other factors determining toxicity, we're going to get into duration and frequency of exposure. So we have acute exposure, which is a single dose. It's a big dose given at a single time. It's exposure to a chemical for less than 24 hours, usually a single dose, like I said, occurring for a single incident. Iron overdoses in piglets is a problem, so death within a short period of time, and insecticide ingestion in animals, which is also death within a short period of time. Subacute exposure has to do with repeated doses, is exposure to a chemical for 1 month or less. So dogs eating an aflatoxin contaminated food for 4 weeks, this causing liver damage. And then we have subchronic exposure, which we probably won't see much in practice, she said. This also has to do with repeated dosing. It is exposure to a chemical for 1 to 3 months. And then we have chronic exposure, which we also won't see in practice much, which is exposed to a chemical for more than 3 months to years. This also has to do with repeated dosing. So getting into aflatoxins, they can be acute exposure to subacute exposure, sources being ingestion of contaminated food. Aflatoxins are produced by Aspergillus species fungus. It's usually a fungus that actually grows on corn. It has a predisposition of Aspergillus species to grow in hot and dry weather, actually, and some take this corn, actually this moldy corn right here, and they actually grind it down to make dog food, and this is how dogs are getting exposed to it. The mechanism of toxicity, aflatoxin B1 is what we're most concerned about. The liver does the work most of the time, and CYP450 metabolizes it. The liver conjugates this to glutathione to excrete it. However, the aflatoxin B either forms DNA adducts in the liver, leading to hepatocellular carcinoma, or it binds to the hepatic proteins, leading to hepatotoxicity. So now we're going to get into route of exposure for factors to determine toxicity. Oral is the most common route of exposure in veterinary toxicology. It requires nearly all of the dose to pass through the liver before reaching systemic circulation. So ingested in large animals, this would be like Japanese hue, old wood that is treated with arsenate, cocklebur, and pesticides. So here's an image of this for large animals. And then small animals is our marijuana, our methylome, our retinoside, gum, actually, Prestone oil, which has the glycol in it, and then Motrin as well. For dermal, so that means topical and percutaneous. We have sprays, a flea spray that I guess a lady sprayed on her cat way too much, and her cat actually got toxicity. And then we have spot on flea and tick, that going dermally. And then we have inhalation as well. So lungs have large surface areas, so increased absorption, and it avoids the liver pass effect. So metabolism can occur in the lungs for P450 enzymes. And then we also have our toxic gases. She gave us a case. It was a bird. We have a 27-year-old male and a 2-year-old female. They were Indian ringneck parakeets. The owners found both of these birds dead, which in turn she got a history. So they cooked breakfast Saturday morning on a nonstick griddle. The 2 dogs in the household were unaffected. The bird cage near the kitchen was next to the table. The owners admitted to leaving the griddle on to heat up and got busy in the kitchen and left the hot griddle on high temp for an undetermined amount of time. So their gross findings were they had marked diffuse pulmonary congestion and edema in the lungs. They had respiratory capillaries collapse, and they had hepatic congestion. This was due to Teflon fume poisoning. So whatever was on the griddle, Teflon, heated up, released this gas, and that's how the birds died. So Teflon fume fever is the overheating of Teflon-coated pans, forming toxic particulates and gases. So it's flu-like symptoms in humans as well. So it can be toxic to humans. Clinical signs are acute pulmonary distress and dyspnea, convulsions, and death. Necropsy is acute severe to massive hemorrhage, pulmonary necrosis, and edema. Inhalation and toxicity, birds are very sensitive to gases, so that's why the birds died. It's highly efficient at exchanging gases for high oxygen delivery to muscles for flight. They have high metabolic rates, so small in size, and the air breathed is rapidly distributed to tissues. Peritoneal routes, not usually, but intravenously, this is our issue, is given directly into the bloodstream. It reaches target quickest. And then we have intraperitoneal. This uses experimentally to mimic oral exposure, reaches target quick but first pass effect. We have subcutaneous, given in the subcuties, so slow sustained absorption, and then we have intramuscular, which is slow sustained absorption as well. These are very rare though to get toxicity that way. Other factors determining toxicity: the species of the animal involved in the case. So most exposed are labs and golden retrievers, actually, for our small animals because they eat everything. For our large animals, it's cows because they eat everything. And then for our least exposed, but they are more sensitive to toxins, actually, which is ironic, are our small animals being cats and our large animals being horses. So that was the end of that one, and then we had her for actually another hour. So toxicology 2, we got into ADME. ADME means absorption, disposition, metabolism, and excretion. So where do all these things happen? So absorption is in the rumen. So will it get into the bloodstream? How and what route? Metabolism has to do usually with the liver. So will it remain intact? Excretion usually has to do with the udder and rectum. So how will it get out? Urine, feces, milk. And distribution has to do with bones usually. So where will it go? Our toxicokinetics, starting with absorption, is the process by which toxins and toxins cross membranes and enter the bloodstream. So we have the GI tract, the lungs, the skin, the eye, and the uterus. This all depends, though, on the solubility of the toxin, of course. So lipid solubility of the neutral or non-ionized form of the drug is more readily absorbed. So lipophilic toxicants like organophosphate and carbamate insecticide. And then we have our insoluble salts that don't get absorbed readily. These are our barium sulfate, which is used in contrast radiology, actually. So it depends on the gradient ionization as related to the pH and pKa relationship of the toxin. So the pKa is the acid dissociation constant measuring the strength of an acid. So the lower the pKa, the stronger the acid. Unionized compounds, so more water soluble in general, so they're not passively absorbed. And then our unionized compounds, so more lipid soluble and therefore can cross membranes. So they're more lipid soluble in general, so they passively absorb. Absorption in general, weak acids pass more easily. They diffuse through the stomach. Weak bases, however, are more absorbed into the intestines. Morphological and functional difference of the GI tract among the various animal species. So ruminants versus monogastrics. Let's see. So rumen has a pH of 5.4 to 6.8. So we have fermentation by the microflora. In our old mason, in our cattle, we have a pH that equals 2. So they're doing the absorption of fluids. In the reticulum, we have a pH of 5.4 to 6.8, which does fermentation. We have our abomasum, which the pH is from 2 to 4. This is known as our true stomach again, and they do the digestion of proteins. The rumen microflora, so they do nitrite toxicity. Their hay actually contains more than 1% of nitrate. We would think this is high. However, nitrate, they yield into nitrite, which yields into ammonia, which yields into a protein. So the intake of nitrite and the conversion to nitrate exceed microflora's capacity to reduce nitrate. So the nitrate is absorbed in the blood and oxidized hemoglobin. So iron is converted to iron 2+ is converted to iron 3+. The methemoglobin and the red blood cells cannot carry oxygen to tissue. So vasodilation happens, methemoglobinemia happens, so that's brown colored blood. Hypoxia happens, and cyanosis. So this is when the rumen microflora cannot change nitrite to nitrate. So then you get toxicity that way when you have too much nitrate that's being ingested. So continuing, so gastric motility, secretion and the rate of gastric emptying. So decreased gastric motility means emptying can increase absorption of toxins, toxicants, and drugs. The prevention of absorption, decontamination protocols, they induce emesis, so this is hydrogen peroxide, and apomorphine, this makes animals actually throw up, and also activated charcoal, so with or without cathartic. For dermal, lipid-soluble compounds are well absorbed. Formulation and solvents can facilitate absorption. We have fipronil, which blocks the GABA-gated chloride channels in insects. We have methoprene, which is an insect juvenile growth hormone analog. And then we have ethanol, which is a vehicle for product. So dermal, we're talking about frontline plus here. So ADME distribution continued. Liver and kidney are the main organs. So distribution, when a drug or toxin enters into the systemic circulation by absorption, it gets distributed into the body's tissues. This depends on several things though, however. So the perfusion, so blood flow through tissues. The liver is the main organ used for necropsy for toxicology. Protein binding of a drug. Acidic drugs may bind protein and remain in circulation, which yields low volume of distribution for that drug. Basic drugs tend not to bind protein and are extensively taken up by tissues, so they have a larger volume of distribution. Toxin drug distributed via the bloodstream. Portal blood circulation goes to the liver. Poison and drugs not equally distributed throughout the body, so they tend to accumulate in specific tissues and fluids. The blood-brain barrier tends to exclude hydrophilic poisons and drugs. So the blood-brain barrier, young animals are more at risk due to the immature blood-brain barrier. This leads to lead poisoning in cats. So it usually happens when houses are being built or remodeled because of the lead paint, so they inhale this way. Also, ivermectin toxicity in collies. They are deficient in P-glycoprotein. The P-glycoprotein function as an efflux drug transport pump to the blood-brain barrier. Ivermectin cannot be transported out of the brain in MDR1 deficient animals, so they act as GABA instead, which is an inhibitory neurotransmitter against agonist. So turtles also have this effect, as well as collies. So the drug then accumulates in the brain, causing CNS depression and ataxia, CNS depression, and mydroasis. Highest concentration of the toxin or toxicant may not be found in the target organ of toxicity. So lead is a GI irritant. It's a neurotoxicant. Leads to VD, blindness, and nystagmus. Liver and kidney damage. So how lead goes through the body, it's similar to where calcium is actually found. So it goes from the blood to the liver to the kidney to the brain to the bone. Now talking about metabolism, it's the conversion of lipophilic toxicants to hydrophilic chemicals. So we have phase 1 reactions, so also phase 2 reactions. So phase 1 reactions most occur in the liver. It means functionalization reactions. So this converts xenobiotic to a more polar metabolite through hydrolysis, reduction, or oxidation. In some cases, it makes it more amenable to phase 2 biotransformation. Phase 2 reactions, conjugate reactions, the liver is adding something to the compound, making it more hydrophilic. Conjugation of a large polar molecule to render a xenobiotic hydrophilic for excretion. So it does not always result in less toxicity or inactivation. So metabolism, basically the animal is trying to make a compound that they can excrete out through the urine or feces. So continue, both phase 1 and phase 2 reactions can inactivate, detoxify a xenobiotic agent. However, they can also activate the xenobiotic agent to pharmacologically active metabolite, which is bad as well. Phase 1 reactions may metabolize a xenobiotic agent to a toxic metabolite, so drug or chemical converted to a more toxic agent. Acetaminophen, also known as Tylenol, can be metabolized to a toxic metabolite. Too much, or for cats, since cats are deficient in the glucor or nyltransferase, it overrides the liver overrides liver, so they can't do glucoordination or sulfation. Thus, it gets metabolized into a toxic metabolite. And lastly, with excretion, kidneys to urine or bile to feces also has to do with milk, which is the route of excretion of the toxin toxicant, can affect the degree of toxicosis in the animal. Milk of cows tends to be slightly acidic, plus milk fat. Their pH is actually 6.5 to 6.9 relative to plasma, which is 7.2 to 7.4. Milk tends to concentrate basic fat-soluble toxins, drugs. They relay intoxicants to nursing calves, also to humans. So white snake root poisoning, toxin trematol or trematone or related chemical metabolized and excreted in milk. So this is known as milk sickness. So there's no clinical signs in the female mom, but clinical signs in her baby calves. White snake root toxicosis is through the drinking of milk from lactating cows and eating white snake root. So the calves get it from drinking mom's milk, and we get it from drinking milk. Calves are affected with muscle tremors and death. A lactating adult cow may remain unaffected, however. The rate of excretion can affect toxicity, ion trapping, so trying to increase rate of excretion of the poison. So altering the urine pH to inhibit reabsorption of toxins across the renotubular membranes into the bloodstream. So the principle is to trap the toxicants in its ionized form from in the urine, so it will be excreted. Non-ionized toxin can diffuse across cell membranes because of their lipid solubility, whereas ionized molecules cannot diffuse across lipid membranes. Methamphetamine is a weak base, so we need to make it ionized so it can be excreted in the urine. Thus, need to make the urine more acid to pass through the urine. So we would give ammonium chloride in this instance to acidify the urine. The percent ionized charge methamphetamine increases, so then 70% of the drug would be excreted in the urine. So now getting into physiological factors. So animal environment interactions that predispose to poisoning. The animals explore the environment, so they taste what they find. They drink from streams, puddles, wells not suited for drinking. They roaming increases likelihood of exposure to poisons. Overgrazing can increase likelihood of ingesting poisonous plants. When they are hungry, they eat what is available. Genetic or species difference also are factors. Individual variation, the age of the animal, young versus old, pregnancy, lactation, disease conditions, and nutritional status. So genetic or species difference, so behavioral, dogs and cats lap up liquids, chemical burns on the tongue and lips. Species differences is cats are deficient in that gluco or nyltransferase, so acetaminophen, and dogs slow in metabolizing theobromine, so that equals a long half-life. Chocolate toxicity in dogs, their species difference. So adenosine, it prepares body for sleep, decreasing catecholamine release and causing vasodilation. Receptors on nerve brain cells can't tell the difference between adenosine and caffeine and theobromine. So without adenosine, brain activity increases, which equals stimulation. So caffeine, theobromine, and theophylline inhibit adenosine and increase catecholamine release, resulting in CNS stimulation, tachycardia, diuresis, smooth muscle contraction, and vasoconstriction. This causes the release of dopamine, so that's a happy neurotransmitter, and glutamate, which yields excitatory neurotransmitters. The theobromine content is what we're worried about. Not so much the chocolate, but the theobromine in the chocolate. So dark chocolate is bad. The cocoa bean mulch is also bad. So they take this chocolate and make it into mulch, which then the dogs eat, of course. LD50 dogs. The LD50 for dogs for chocolate is 250 to 500 milligrams per kg. And then LD50 for cats is 200 milligrams per kg. So here's our chocolate. How much they would need to eat in order for it to be toxic. So why are dogs predisposed to toxicity? They have a long half-life of theobromine. The half-life is about 17.5 hours. For caffeine, it's only about 4.5 hours. Theobromine is metabolized into anthyme, which yields methyluric acid by hepatic CYP450. Half-life is the time required for the concentration or amount of substance in the body to be reduced by 1/2. So how quickly the drug is eliminated from the plasma. So shorter the half-life, the faster the drug is eliminated. So in 1 to 2 hours, if they eat chocolate, your dog's going to show signs of tachycardia. So heart rate is high, hypertension, blood pressure is high, hyperactivity, CNZ, excitability, muscle tremors, vomiting, diarrhea, and tachypnea, which is rapid breathing, and respiratory failure. Clinical signs can last up to 1 to 3 days. You can have mild, so estimate exposure based on worst case scenario. So we look at a 10.6 kilogram golden retriever eating a 10-ounce bag of Hershey's Kisses, or a 2.2 ounce square of baking chocolate. So Christmas is the worst holiday for dogs ingesting chocolate. Hi guys, so my phone decided to blip out and I thought I lost the video from earlier. Then I turned off my phone and turned it back on and I found it. It's saved. It didn't disappear. So ending the toxicology lecture, age of the animals. So younger animals have a blood-brain barrier still mature, more permeable than adult. Their GI motility is immature. They have lower glomerular filtration, so they can't filter as well through the kidneys. And also the rumen microflora is low. In older animals, decreased metabolic capacity is longer. They have longer half-life of xenobiotics, decreased kidney function. For pregnancy or lactation, their hormone changes can affect metabolism. Circulatory changes can alter distribution, increase susceptibility of fetus to some toxicants, excretion of fat-soluble pesticides, so organochlorides and fat-soluble pesticides, lead, and trematone. Disease conditions such as heart disease, so cardiotoxic plants and feed additives. Kidney disease is decreased excretion. Liver disease is decreased metabolic detoxification, decreased proteins, so like albumin and clotting factors, and also dietary factors and nutritional status, so selenium deficiency or toxicity. So again, selenium prevents free radical damage in tissues. It maintains proper immune, muscle, heart function, and selenoproteins and skeletal muscle helps cells sequester calcium. So that was it. So I gotta finish, and I was like so mad because I only had like a minute left. But I hope you guys all had a good day today, and those are my lectures for today.